afternoon and welcome to Channel 7 News. I'm your host, Trey Faber, and today we're going to be speaking with an inpatient pharmacist. So what I know about pharmacy is you count 1, 2, 3, 4. Apparently it's more than that. So today we have Dr. Amy Braden on the show. Doctor, welcome.
Thank you for having me.
No problem.
Let's see Dr. Braden live in action.
Pharmacy, this is Amy. How can I help you? Hi, Dr. Lynn? Yes. Oh, okay. So the heparin order, you want it changed? What's the date of birth? 9/10/1982. And what dose are you considering for the patient? Okay, 1,500 units of heparin. And first and last name of the patient again? John Smith. And does the patient have a medical record number? Okay, 155346. Okay, yeah, that sounds like a good dose to me. I'll go ahead and enter it. You're welcome. Bye. Entering orders today. I have a patient that needs to take vancomycin, which is an antibiotic. This patient has infective endocarditis. So I got the order on the screen. I just need to do the necessary calculations. So this patient is getting vancomycin 1,500 milligram. That's in D5W, which is dextrose 5%, in water, and that's going to be a 500 milliliter bag. This medication is dosed twice daily, so this patient will receive an IV, and that usually runs for a certain amount of time. The dosing is actually 15 milligram per kilogram. Also, this patient is receiving this medication orally as well, so that comes in a liquid form, and the reason that they have IV and oral is because they have an infection in their intestines and also systemically. So that's a little bit how I would take order entry.
So I'm going to ask you a few questions about your career just to learn more about it and help educate the public. So tell me, what do you like most about your job?
There's a few different things I like about my job. Right now I have more of a leadership position,
Okay.
so I'm really liking that. Also, I do residency orientations. I do the API and IPI.
Now, let me stop you there. What are API and IPI? I'm not sure.
So IPI is Introductory Pharmacy Practice Experience. So that's the beginning students through their first and third years. They will come in and experience pharmacy. API is Advanced Practice Pharmacy Experience. So those are the students in their last year, and they're about to become pharmacists after they pass their NACLEX exam.
Okay, so it's kind of like on-the-job training type deal. Okay, cool. Okay.
Other things I like about my job, it's kind of like HR. I get to deal with different aspects of the employees, and I also take care of scheduling.
Okay, awesome. So, what do you like least about your job?
The part that I like the least is regulatory compliance. There's a lot of different regulations that we have to be on top of in order to stay accredited and to have safe practice techniques. So a lot of that is like temperature, making sure that the IV hood is clean, and just like infection prevention and all that.
Okay. Now, this is the question everyone wants to know. What's the salary range for your field?
So the salary range is like 105 to 120,000. I do have a more of a leadership position, so that kind of boosts me up a little more.
Okay. All right. Now, did you complete a residency to obtain your current job? If so, where at?
Yes, I did complete a one-year residency at the U of L hospital.
Okay. What does your average day look like?
So I usually start at 6:30 in the morning, and every day we have a safety huddle meeting where we go through the different things that are going on, different critical patients. Also, I have meetings throughout the day. There's drug shortage meetings. I have leadership meetings that I need to attend. It varies day to day, and oftentimes my day is different than every other day. My day usually ends at 4, but sometimes I work a little longer. Also, I deal with drug diversion, so I'm looking at that data as well.
Okay. On average, how many hours per week do you work?
I always tend to work more than 40 hours Monday through Friday, just because it is a leadership position, so there's different things I need to do, and usually I always work over 40 hours. I don't tend to come in on weekends unless there is like staff shortage or there's a major issue going on.
All right. Is being an inpatient pharmacist challenging on a daily basis, and if so, why?
It definitely becomes stressful. There's so many different aspects of the job. We also are a level 1 trauma center, so that can be overwhelming. So it depends. You have to be able to do lots of different things all at once. You're doing drug entry and reviewing medications and different interactions. You also have to be able to talk to doctors and nurses on the phone and just sort of juggle checking what the technicians are doing and just all of that. It can become stressful.
Yeah, I would say so. It sounds like a lot. So, following that, what advice do you have for a student wanting to go into this profession?
So you should definitely try to keep your grades up. You should see if you can get experience in the workplace. Also, just explore all different kinds of career options other than this as well. And just keep your mind open.
Okay. So, what drove you to choose health system pharmacy over other pharmacy pathways?
So I really liked health system pharmacy because there's more critical patients and I can kind of have more like of a fulfilling role rather than maybe retail. I kind of got just sort of placed into the leadership position, but I am enjoying that as well.
Okay. All right, and last question. What do you feel are the most important attributes to your job?
So we're helping a lot of people. We have critical patients. Like I said, it's a level 1 trauma center. So there is lots of different drugs that many hospitals don't use. And those drugs are pretty critical to the patient. Other than that, we're helping people, but also we're making a difference in people's lives and saving lives, and so that always makes you feel that you're helping people.
Absolutely. Well, Dr. Braden, thank you so much for your time.
Thank you.
It turns out pharmacists do quite a bit in their job. And as always, stay classy, Charleston.